know when spine surgery is the right option for you. You've tried everything, physical therapy, medications, injections, but the pain just won't go away. When is it time to consider spine surgery? It is a big decision, but knowing the right signs can help guide you. In today's video, I'm going to help you figure out when spine surgery is the right option for you and when to explore other treatments instead. Hi, I'm Dr. Deeptee Jain, an orthopedic spine surgeon. And on this channel, I share valuable tips about spine health, from preventing injuries to making informed decisions about surgery. I have performed thousands of spine surgeries in my life. If you're struggling with back pain and wondering if surgery might be the best option, you're in the right place. Be sure to subscribe for more spine health tips and insights. I know that the idea of spine surgery can be scary, and it is scary. Bad things can happen. Surgery can be a life-changing option when other treatments have failed for the right indications, and it can improve your quality of life significantly. But there are always risks involved. I always say to my patients, the decision to undergo spine surgery is bigger than the decision to get married. You can take back getting married, but you cannot take back what I do to your spine. The key is knowing when it is the right choice for you, and hopefully this video will help guide you through that process. Spine surgery is generally considered in elective cases when non-surgical treatments like physical therapy, medications, and injections haven't helped to alleviate your pain, and when the problem is causing significant impairment. Importantly, not every spine condition and every case of back pain will get better with spine surgery. Here are some conditions where surgery might be the right place. Herniated disc. If there's a disc that's pressing on a nerve and causing chronic pain or numbness in your leg and non-operative treatments haven't worked, surgery may be helpful. Spinal stenosis, or what is medically known as neurogenic claudication. That's a big word. When the space around your spinal cord narrows, causing nerve compression and severe pain, surgery can decompress the area, create more space for the nerves, and most likely provide pain relief. Spondylolisthesis. So this is when one vertebra shifts forward on another vertebra. This motion or instability is abnormal, and it can actually really irritate the nerves in the spine. Surgery may be considered to stabilize the spine as well as decompress the nerves. So when is surgery right for you? The truth is there is no right, there is no wrong, and no one other than you can make that decision. We do spine surgery when you decide, I am miserable, my pain is so severe, and I am willing to undergo the risks and the recovery of spine surgery to feel better. Here are some indications that spine surgery may be the right option for you. Persistent pain. If the pain is constant and doesn't improve with physical therapy, medications, or other non-operative treatment options. Numbness and tingling. If you experience significant numbness or tingling down your legs and it doesn't improve with other treatment options. Weakness or loss of function. If you experience any weakness in your legs, feet, or arms, making it hard to stand, walk, or perform everyday tasks, surgery might be helpful. Loss of bowel or bladder control. Now, this is a much bigger deal. If you lose control over your bladder and bowel function, it could indicate a serious condition like cauda-equina syndrome, which requires emergency surgery. There are several types of spine surgeries depending on your condition. In general, we say we do one of three things during spine surgery. We decompress, we fuse, or we decompress and fuse. The most common types of spine surgery include decompression. This is a procedure that involves taking the pressure off of the nerve roots. This can include a discectomy, where the surgeon removes a portion of a herniated disc to relieve pressure on a nerve. It can also include what's more commonly called a laminectomy, which often involves taking down arthritis like bone spurs and thick ligaments to relieve stenosis. A spinal fusion. In cases of instability or when there's abnormal motion in the spine, the surgeon may fuse two or more vertebrae together to stabilize the spine. There are lots of different ways to perform a spine fusion, and this will be the subject of a future video. Importantly, like any surgery, spine surgery does carry risks, and the very specific risks depend on the type of surgery you are having. Some potential complications include infection. Although rare, infections can happen when we do anything to the body, especially when we're putting in metal, including cages and rods. Now, I perform minimally invasive spine surgery, and so that infection risk is much lower. You can have medical problems like blood clots, heart attacks, strokes, kidney injury. You can also undergo nerve damage. Though uncommon, nerve damage can occur during surgery, which can potentially affect your motor or sensory function. If you're having a spine fusion, you can also, down the road, experience or develop what's called a non-union, and that's when the bones don't heal after a fusion. This can potentially necessitate future surgery. So to recap, here's when spine surgery might be the right option for you. Persistent pain that doesn't improve with other treatments. That's usually the most common reason. Numbness, tingling, or weakness in the arms, legs, or feet, or loss of function of bowel and bladder control. Remember, spine surgery can offer long-term relief when the other options haven't worked for you, but it's important to discuss all of your options with your doctor. If you found this video helpful, please like, share, and subscribe for more spine health tips.